My name is Kelly Fitzgerald, and I'm the Vice President of Grassroots Development at Alliance Group. We're a firm here in Virginia, and I work with several healthcare groups across the state on grassroots lobbying and alliance development.
Rodney Hunter. I'm a pastor and also co-director of Virginia Interfaith Center for Public Policy, Richmond, Virginia.
I'm Kelly Cannon. I'm the Director of State Advocacy for the Virginia Hospital and Healthcare Association.
I'm Jill Hanken. I'm an attorney at the Virginia Poverty Law Center, where I specialize in health work and health advocacy. And please join us in this conversation. We are all members of a coalition called the Healthcare for All Virginians Coalition. There are 100 organizations in Virginia who have come together to work for health advocacy issues. And the issue we've been working on for the last 5 years is trying to get Virginia to expand its Medicaid program for more low-income Virginians. So how do you think we're doing, Kelly?
We're getting close, Jill. You've been working on this issue for 5 years. Some of us have come to the table sooner, but it's been hundreds of thousands of volunteers have come together working on Medicaid expansion over the last 5 years, sending emails to their legislators, showing up in Richmond for rallies, attending events in their districts, and it's really exciting to see us getting closer and closer, hopefully a month or so away.
Absolutely. I think one of the great things about us getting closer is seeing over the years that we've been working on this, how many new types of stakeholders we've seen come to the table and to the coalition and to the wider cause. Now we have more of the business community involved. We have not just everyday people, but organizations that are kind of cropping up all over Virginia that have recognized that healthcare is such a huge part for themselves and their family, but also for their communities, and they want to do something to make it better. And they really, I think, have seen the benefit of doing something about this. So that's also been a really unique and interesting thing, I think, for a lot of us that work in grassroots to see how many different people have come to the table, that hopefully we're speaking in one voice now.
And I think, too, you can see the legislators are changing a lot, too, and that's because of the impact of the volunteers and groups coming together. And it's good for the religious community in which I represent, because churches and mosques and synagogues are always looking for ways to bring justice to their community and to the commonwealth. And I think it's really happening now, and as progress is being made, I think it's making people much more involved and giving them hope to see health care, Medicaid expansion become a reality.
Yeah, we hope so. It's been difficult. It's been a very hotly contested issue for all these years, but we have a lot of momentum this year. Some that's a result of the change in the makeup of the House of Delegates. It's been very gratifying that our new Speaker of the House, Kirk Cox, and Chairman Chris Jones of House Appropriations support Medicaid expansion, and the House is on board with like 19 Republican delegates signing on to the House budget, and we're right now waiting for the Senate to come around as well. What's it going to take?
Well, I think, and I'm interested on everybody's take. I think it is, for so many issues, it's finding that path forward that helps everyone. And I hope that, what we're able to do is, again, always bring things back to that patient story and the people that that this will help. And then I hope that makes finding a way forward a bit easier. I think there's different options on the table, and some of them have good aspects, some have bad. And so I think it's about everyone realizing that moving forward is the most important step, and then finding that kind of consensus. So I think as soon as that kind of can happen over the next couple of weeks, I think hoping for movement. So, but interested on everybody else's take as well.
I think we've seen just a growth in public support for this issue grow over the last 5 years. So it started with when the ACA was first passed, became obviously a very polarizing issue and may still be an imperfect law, but is more clear that it's here to stay. And that's where I think we've seen changes in the legislators' minds. Mm-hmm. We've also seen public support in looking at public polling grow over the last 5 years. We're at the point now where 83% of Virginians publicly support expanding access to health care. That's a huge number when 83% of Virginians, I don't know if we could agree that the sky is blue right now.
Yeah.
So I think that's made a big difference, and I think that's what's moved the House towards a 67-33 vote in support of expansion in the House budget, and hopefully what's going to help encourage the Senate to join them.
And then too, when you look at what's happening to our nation, the poverty rate is just increasing. And as a minister, the issue for many families is somebody gets sick, and that impacts their income. It impacts food for their children, utilities. And as a pastor, we're getting bombarded with people who need assistance. So this is just a good, I think, policy that we really have to have, and we need it really quickly.
Right.
Because churches aren't equipped to do the financial piece for so many families. So I think that's changing the face of how politicians are seeing things too.
Right.
Because it's just something that has to happen.
You know, it's interesting how many people are still surprised when they hear the facts about who will benefit from expansion. There are lots of images out there that are just simply not correct. First of all, it's a single person, single adult who has income under $17,000 a year. So we're not talking about people who have a lot of money. And those adults, if they're not parents of minor kids, they can't get Medicaid at all, even if they have zero income. So we're helping people, adults, single adults with income from $0 to $17,000 a year. And we do a pretty poor job in Virginia helping parents right now in our Medicaid program. A family of 3 has to have income below $10,000 a year in order to get Medicaid. And this new expansion would increase that income level to $28,000 a year for a family of 3. Still not a lot of money, but obviously a much broader assistance for people who really need it. And most of the folks we're talking about are people who are working. Over 70% of the folks who are uninsured are living in families that have a member who is working full or part-time. So talk about people who are irresponsible or not trying hard enough. That's just not true. And I'm sure all of you run into folks who are uninsured and have very compelling stories about why they're uninsured and what it means to be uninsured.
Well, I think the reforms that have been done to Virginia's Medicaid program over the last 4 years have really created an opportunity now that when we expand, giving folks access to health care coverage, to preventative care, to regular appointments with their doctors, to address underlying chronic conditions that are impacting their ability to work, make it really more of a hand up than a handout. And I think that's where we've seen political change over the last couple of years.
Absolutely. And I think one of the interesting things over the years working with patients who many times are chronically ill or in the rare disease community, they will tell you time and time again that they just didn't understand how important health care was and having some type of coverage until they got sick or their child got sick. So then it becomes a very personal thing because you do realize how it not only impacts that person and that family, but also their community. It's such a domino effect. If you don't have access to those preventative services, if you don't have access to, let's say you are already, you do have a condition that you need long-term treatment for. If you don't have access to that, you can't go to work. You can't continue to be a tax-paying citizen. So you're not only affected, our Commonwealth of Virginia is affected, that employer is affected, that community is affected, that church is affected, because you can only help so many people with the wonderful resources that you have. So I think it's about, just like you said, it's not a handout, it's a hand up, and it's helping everyone. Those communities continue to be strong all across Virginia. Virginia is such a wide-ranging state with our rural and then our, more urban areas. We have such unique and different needs. And I think when we work in the legislature, we see that depending on where a legislator might be from. They have those, really indigenous knowledge and kind of projects that are close to them. But I think healthcare is one of those things, like education. It unites everyone, no matter where you are, where you live in Virginia, how much money you make, but especially for this population, if you do not have access to healthcare, it will not just affect you, it will affect everyone that you live with and in your community. And I think as a uniting driving force. Again, that's, I think, sort of why we've seen that groundswell from different areas as well and different legislators. So
I think too, hopefully by having so many different organizations and people come together, I think it's good. You use the term image, where for some reason it just seems that sometimes politicians always think that a program is for people trying to use this system or get over on this system. But that's not the case. And you said people are hardworking. They're just low-income individuals, and many don't have health care. So I think we're getting the message out that these are hardworking people, and they are Americans, and they too deserve to have health care. And as you're saying, it's a win-win as far as they're able to pay their taxes, they're able to have preventative health, and that's just good for our society. So
Exactly.
I think this is a good. The coalitions, I think, are working well to raise the image and level of the politicians to say that this is a good thing for America, for the Commonwealth.
Right.
And speaking of taxes, yeah, I mean, healthy people can work, and healthy people can work and pay their taxes. And what we're talking about here is bringing Virginians' federal tax dollars back to the state to do something that helps us, because we've been paying taxes to the federal government all this time and not using those dollars, not bringing them back to Virginia to use for Medicaid health insurance. And there are 32 other states that have done that. They've taken their tax dollars back home, and we've just forfeited $10 billion. And so I think that has resonated with some of the legislators too. It's time to bring that money back to Virginia, because the money itself does so many different things. It helps our hospitals and other health providers, and it creates jobs, which then generate more revenue. So Kelly, from the hospital's perspective, is it going to help?
It's absolutely going to help. Right now, we're in a state where when people need medical care, when they need emergency care, they have a place to go. They turn to their hospitals, and they're not going to turn them away. But the cost of that care is adding up. It's in the billions of dollars per year that hospitals are putting into their charity care, into their community benefits. And those who do have health insurance are helping to subsidize that, are helping to foot that bill. So we see Medicaid expansion as a great opportunity for the federal government, for our federal tax dollars that we've already paid, to come back to Virginia and help to provide that care in a more meaningful way, so that folks are getting care before they need to walk into the emergency room, so that they're able to see providers for regular ongoing care.
Yeah. Right. I think it's also a great opportunity for what we always like to talk about, which is the Virginia way. It is a great opportunity right now. The House has done their work. The governor's office has been just wonderful. The Senate has been great as well, and sort of, coming to the table and having discussions. We want them to come a little bit further, and that's what we're all, I think, hoping for. But that's a great opportunity. That's what this is. We have different viewpoints. We have different people coming from different perspectives. But together, we all kind of add different things and different components that, again, hopefully craft that in a way that this is ours. This is Virginia. We know our state better than anyone. We know the needs. We know how important healthcare is. And this is an opportunity to mold this and create something that can help people, but again, is really tailored and specific to the needs of our state. And I think that's an amazing opportunity for us to be able to do. So I hope also that the General Assembly will kind of see it as a way to be on the forefront of things, and to really kind of, again, craft something that is successful, that we can show up as a model to other states that maybe are still thinking about it, others that have already come out with their programs but might want to make tweaks, to it. Let's create something great, and then kind of give that to the rest of the country. I think that's a great opportunity to do that as well.
So you're saying this is really democracy at work?
I think so.
A lot of citizen engagement. We don't have the opportunity.
I think so. It is. I mean, when you really kind of step back and look at it, this is why we all do this, and this is why we all are here to help people. So yeah, I think it's an amazing opportunity.
And you're saying that, and it makes me think too of how important it is when we talk about democracy and we talk about the legislative process. It's an educational piece.
Yeah.
And I'm just thankful that by getting on board, I get educated to really how many people are affected and what part we should play, what we need to do, how many people are hurting. And it's just good. And I think that this helps us to really, as we are educated, then we can help educate our legislators too. Let them know here's what's really happening to your district. So that's why I think this coalition and all of us working together has been beautiful. So.
Yeah.
I think you make a really good point. I think this issue has galvanized folks to get involved with state level government affairs in a way that has never happened before. So folks, for the first time, they're coming down to Richmond. They're coming to the Capitol and to the Pocahontas General Assembly building, our interim location. So they're not getting the full experience quite yet, but they're meeting with their legislators, and what they're finding is these are real people who are accessible, who go to the grocery store back home in the district just like they do. And so they're finding that sharing their stories with their local representative has an impact. They've actually seen them change their positions on votes, and I think it's really exciting to see that level of citizen engagement and that level of responsiveness between individual citizens and their representatives.
When would a preacher really come together with lawyers and
Advocates, yeah.
What else would bring us all together?
Right.
Yeah.
But I think too we've done a great job, and Jill really has done such a wonderful job with the whole coalition, but also making sure that we're not just hearing this message in Richmond. So we've had events all across the state, in every single corner, invited people from both sides of the aisle, from the House and the Senate, also stakeholders, people from the hospital community as well, and other people from those local communities that can hopefully make an impact. To have forums, to have social media posts. The social media, that we've seen on this has also been just wonderful. So I think you've just done such a great job, kind of spearheading everything along with your team. And
This is a coalition of
else,
lots of
but
people and lots
yeah.
of talent. So certainly, I don't know anything about social media, so I'm not responsible at all for any of that. But it has been great, as far as I know.
Yeah, that's okay.
But it takes a lot of people being engaged and committed for the long haul, because that's what this is. And it's not over. I mean, I think that we can't congratulate ourselves until we've got this over the finish line. And so it's just important to know that it ain't done until it's done. And at this point, we still need the Virginia Senate to understand what we've been describing today, how important this issue is for the individuals who would get health care, and for the Commonwealth of Virginia, which would receive a lot of money from the federal government to do all sorts of things. And it's an investment in our future. And so they come back to Richmond on May 14th, and between now and then, and probably a few weeks afterwards, we still have to keep working really hard and get more people engaged to share this message to all of them, so that we can chalk this issue off as a win, and then work really hard to help people know about the new coverage and get them enrolled. So I mean, that'll be phase 2 of this, is to make sure that the 400,000 people who could potentially gain coverage know about it and get enrolled. And we haven't talked much about some of the hoops that people might have to jump through, because there are some there's some red tape and bureaucracy that some folks might have to jump through to show that they're not able to work, or that they are working, because the House of Delegates really wants that to be a part of this new coverage. And we all support work, but we don't want people to get trapped in red tape and bureaucracy, or to lose coverage when there are legitimate reasons for them to be exempted from those requirements, or they weren't able to achieve what we asked them to. So there's going to be a lot of work to do after the fact as well. But we're all sort of laser focused on the goal, and we're very close. So we have to stay engaged.
So the call to action, I think that's always important, is like the call to action of the week right now, and of the next few weeks likely, is to contact your state senator. Is going online. If you Google "Who's my Virginia legislator," you can find a website where you put in your address. I keep that open on my cell phone.
I know.
You can look it up right now.
Do you know?
Do you know who it is?
If you don't, I can find it.
We can find out quickly. But it's contacting your state senator and telling them that this issue is important to you and encouraging them that Medicaid expansion must be included in the final state budget. We've been telling our members since January, since the General Assembly started the first time around, it's a marathon, not a sprint. But we're starting to get down to those final couple miles, and continued engagement, being patient, but also being persistent is going to be really key to putting this over the edge.
And what's good about your point, I think it's good that we not see our legislators as people so separated and distant from, they're part of us, and we need to see that and stop, being fearful. And that's why it's good to learn about the process and to see them as a part of the conversation, to be able to contact them and go to town hall meetings, because we want to keep them engaged and informed about the communities that they so-called represent.
Right.
I think the Healthcare for All Virginians Facebook page is also a great place to follow to learn more information.
And we have a website as well, so people can get a lot of materials about this issue online through Facebook or the website. And we welcome others to join us and to email us and ask questions, so that we can all be part of this process together.
Yeah.
And too, with the Virginia Interfaith Center for Public Policy, that's what we're about. All of the things that go on in the General Assembly, we have fact sheets and we have persons sharing information. So throughout the Commonwealth, any faith-based organization or any persons can be a part of this organization. So that's what we're here for. So.
And also, if you have a story, so if you are a person who you think, if this were to come to fruition, you would benefit from Medicaid expansion and from, finding more care for people in Virginia, we also would love to hear from you, because that is also the thing that I think has continuously been a benefit to our coalition, is to be able to show those faces and those stories and those families and those kids. So also contact us, through the website, through the Facebook page, let us know, because that's a big deal to be able to put a face with a name. And
it's very powerful.
Yeah.
I mean, I've worked with, we did this a year ago. We talked about different people who fall into the coverage gap, everything from the 19-year-old who had Medicaid when they were younger, but then when they hit age 19, they lost it. Cancer patients who are uninsured, waiting for a disability determination to be made, they're also in the gap. Parents with income above that measly $10,000 a year, their kids get coverage, but the parents don't. And just, low-income working adults. So lots of people are affected by this, and we've tried to paint the picture for the legislators in a way that makes it real.
Well, when we think about the faith community, one of the things we've been doing is, of course, in addition to the work we do with the General Assembly, we pray as well. We go to some of the offices of legislators and do prayer vigils. And we also hope to be a part of to help people register. Let's say if this passes, we want to be a part of helping to educate our congregants, and we want to be able to help enroll them. And that's why it's important for us to be a part of the process, because we can help educate our members and people in the community. Because with issues like this, there's going to be a lot of confusion. So we just see ourselves too as playing a part in helping to educate them to what they can, what their benefits are. And that's always very important. So I see us playing a part with that as we work together. And for you all to utilize us and keep us involved in the process.
Is a huge opportunity for job creation. If 400,000 people get access to health care, that's a number of good paying jobs in the healthcare field, and that's part of the driver for the hospital and healthcare associations. Hospitals are the largest employer in the majority of localities in Virginia, and there's a huge economic benefit to Virginia if we do decide to bring back those federal tax dollars and actually give people access to health care. That's one of the reasons why we've been working a lot with local and regional chambers of commerce. More than a dozen chambers of commerce have come out publicly in support of Medicaid expansion, and that's been an interesting conversation back home in their communities. They've been having little microcosm conversations at the Chamber of Commerce Legislative Board level, just like the legislatures had in their larger caucuses, talking about what does healthcare mean to us as a community, what does it mean to give people access to regular care, and what we found is largely they've recognized the positive economic benefits of giving people access to care and how that can improve, like Kelly talked about earlier, the community at large. So we're really excited to see chambers of commerce continue to come out in support of Medicaid expansion. Hope we'll see even more in the next few weeks. So we run a hospital grassroots network that folks can go follow us on Facebook and sign up to receive action alerts, and we'll try to keep them informed on healthcare issues, because like you said, if we're successful with this issue in the legislature, there will be more to follow, and there will be more work to be done.
Exactly. Our work is never done.
Work for the advocate.
Right?
Right.
One of the really cool things about, I think, the last few years, but especially this last sort of, months leading up to session, and then when we had session, and now still, and why we still have to be talking about it, and it's so important, has the role of social media played, I think, in all of this. It's not a new tool, but for those of us that, are advocates and kind of work in this space, I have just seen it just gain so much momentum and strength during this campaign. I think for two reasons. One, because it's easy. You don't have to get in your car and drive down to the General Assembly. You don't have to, necessarily set up that meeting with that legislator in person to tell your story, even though we absolutely encourage that, and as much as possible, we'll drive you down ourselves to the General Assembly if you'd like to meet with your legislator. But it's a great way for people to get involved right at their kitchen table, right on their cell phone, right at work. And it's also a great way for people to, I've seen a lot of sort of smaller Facebook pages pop up, X community Facebook page for healthcare. And it's a way for people who all live in a neighborhood to have literally a news feed, and they'll post, this is what's going on, we're going to this rally, are you going to meet at the bell tower, we're going to go talk to this legislator that day. And it's been a great information sharing tool, but also for people that, who again sometimes could benefit from this care, they're sick. And they can't go to work because they don't have health care, let alone come down to the General Assembly. So it's also a way for them on a Facebook page of a legislator to tell their story. And I think it's been amazing. And I've heard from offices too, when we've gone in to talk, I've already heard from so many people. I've heard from lots of people in my community. They will say that to us. I haven't heard from anybody on this. Or the converse, which has been so great, is wow, like I've heard from so many people, and this has just been great. So I think it's a wonderful tool, but it's also an interesting, thing to look back on, the role that it played, and hopefully how much of a good thing it was. So.
Well, I don't know if we have any more to add to this in conversation, but it's been great to work with all of you over the years, and
Me too.
Getting so close to a good win, a solid win for the state and for the people, and we'll just have to plan a big party when this is done to celebrate.
Great celebration.